Hi, I'm Sally, and I'm here to talk to you today about COVID-19 documentation tools for use in Sioux Lookout Zone nursing stations. Okay, let's say that a guy called Bob either calls or walks into the clinic. A common question during this COVID time: what form should I use? All the forms in this video can be found by going to onehealth.ca and clicking on Zones, Sioux Lookout Zone, and then COVID-19. To start, all patients, staff, and visitors entering the nursing station require a reception screening questionnaire to be done every time. So let's say that Bob has answered yes to questions about cough, fever, and abdo pain, but he denies travel out of the community in the last 14 days, and he hasn't had close contact with any person who has confirmed or probable COVID-19. So Bob comes into the clinic for assessment. On arrival, he goes through the COVID-specific entrance, is given appropriate PPE, and assessed by a nurse who uses the respiratory illness documentation tool and then consults the MD or NP on call. According to the SLFNA algorithm, this places Bob as being low likelihood of COVID-19, or signs and symptoms but no exposure. Continuing down the algorithm, we will now offer Bob a COVID-19 test and then fax the requisition to SLFNA. After MD consultation and assuming that there are no red flags with Bob, he can now go home to self-isolate. But before he can leave, we need to fill out the COVID-19 checklist for self-isolation that discusses strategies for self-isolation, contact information, and daily monitoring. While at home, Bob will get daily calls or visits that are recorded on the COVID-19 client monitoring record until his test results come back negative and he has been symptom-free for at least 24 hours. Now let's say Bob, with his cough, fever, and abdo pain, has answered yes to travel and contact with someone who has COVID-19. According to the SLFNA algorithm, this now makes Bob a medium to high likelihood of COVID-19. The paperwork doesn't change much. We will still assess and complete the respiratory illness documentation tool and then swab and fax down the lab rec to SLFNA. The only difference with medium to high likelihood patients is that now we're going to call SLFNA so that we can discuss contact tracing, client instructions, and next steps. Once again, after MD consultation and no red flags, Bob can go home and self-isolate. Before he leaves, we still need to fill out the COVID-19 checklist for self-isolation. After Bob gets home, he will get daily calls recorded on the client monitoring record. However, this time it will continue for 14 days regardless of test results. And that's that. Thanks for listening. If you have any questions, please contact your SLFNA Preventing Infectious Diseases nurse or your nurse practice consultant.